Click and be healed. Ting Shih joins me now to talk about ehealth. She's the CEO and founder of ClickMedix. What is it? How does it work?
So it works like connecting doctors to patients, and not just for primary care, but for chronic diseases like diabetes, heart disease, including mental health. So how it works is we try to simplify the process of finding healthcare all the way to heal and recovery, whether it is a chronic disease or an acute symptom. How it works is for patients themselves, they download ClickMedix, they click on the disease area they're concerned about, then our system routes them either to a health coach, a nurse, or primary care doctor or specialist, depending on what their assessment outcomes are in terms of their health condition.
And how effective is it assessing someone's health condition digitally? Often symptoms need to be analyzed in a tangible, more visceral way. Do you lose anything in that process?
So the core of ClickMedix is collecting the medically relevant data so that a physician can make an assessment on whether the patient needs to come in for a physical examination, or they can be prescribed through e-prescription and see if they're getting better that way, as well as referring to other physicians. I think where patients find it challenging, especially the ones with chronic diseases, is on average they have 11 doctors. How do you see 11 doctors?
Right.
It takes a long time,
Right.
and when do you need to see them? So what ends up happening is they don't see them and they go to the ER room or the hospitals because that's where you can get care. And that's not where we should be providing care because of the costs and also the time and also the unnecessary suffering for patients.
And what have you seen patients with particular trends that use the service more than less? Like, is there a particular disease that you see analytically is more requested?
We work with health organizations that will let us know the key diseases that they want to intervene on. Mostly it's diabetes, it's heart failure, it's mental health, and also cancer. So we work with them to identify patients that need this level of help and enroll those patients into the program so that they can more easily connect to the health organizations.
What do you think is the one question every woman should ask herself?
The one question they should... I think a lot of us are, at some point in our life, are wondering, what are we here to do? What is our mission in life? What can we actually do to make a difference? And I believe all of us want to make a difference in this world. So the one question would be, how can I change the world?
What do you think the key issue is that affects women in your region today?
I think women who want to make an impact, some are thinking about it, are just trying to make that first step. And can we as organizations or society make that first step much easier? And not just the first step, okay, what about step 2 and 3? And obviously there's this whole valley of death in startup world. It's the same for women. It's the same for anyone who wants to start a company. And a lot of our focus should be, how do we put a bridge between the valleys so that women who want to make an impact actually get there. And I've seen so many successful women both in nonprofit and for-profit worlds, and it's just amazing to see the ones who's made it, and I know we want to help the others do it too.
Finally, what is the best advice you ever received?
Best advice I ever received? You know, my whole company started simply with the challenge that was to create a business that would impact over 1 billion people. And I never looked back. I don't know if that's an advice, but it was just a challenge that's, yes, I'm gonna do it. I'm gonna do it so I can pass this class, but it just stuck. And I think it's really that first step, you know? So the best advice would be, you know, what is that first step that gets you over the hump?
That you got, the best advice that you got?
Best advice I got, and that's interesting. And I think it's a collection of many advices, and some are silent. And I would say, you know, my mom has been a huge supporter of what I'm doing by being silent about it, by not saying, no, you can't do it. And it's just being supportive and being saying, you know, what do you need? Do you need money? Do you need shelter? Do you need food? Do you need a laptop? And it's just, it's this silent kind of support that's being just helping to push along.
That's wonderful. Thank you so much.
Thank you.
Thank you.